Imagine a virus is so small that you cannot see it, yet so deadly that it can destroy your lungs or kidneys in days. This is Hantavirus, a virus carried by rodents, with outbreaks occurring around the world. Today, we will see what hantavirus is, how it spreads, the risk it poses, and how to prevent it, and whether there is treatment. Stay with me because awareness is the first line of defense, and it could save your life or someone you love. Hantavirus is a rodent-borne virus affecting humans globally, discovered during Korean War outbreaks of hemorrhagic fever with renal syndrome. There are two main diseases here: hantavirus pulmonary syndrome or HPS, America's high mortality, and there is hemorrhagic fever with renal syndrome, which is HFRS. In Asia, Europe, lower but significant mortality. When we come to the transmission, humans inhale virus from rodent urine, droppings, or saliva, rarely, and this virus spreads human to human. The early symptoms are fever, fatigue, muscle aches, headaches, nausea, and in severe cases, lung or kidney failure. Symptoms, diagnosis, and early detection. HPS, early flu-like symptoms, rapid pulmonary edema, then there is respiratory failure. In hemorrhagic fever with renal syndrome, fever, hemorrhage, acute kidney injury. When we come to the diagnosis, exposure history, serology, IgM or IgG, PCR, blood counts, and imaging chest X-ray, as well as ultrasound like kidney ultrasound. Early detection saves lives. Prompt hospitalization is critical here. Are deer, mice, bank voles, brown rats, and others depending on virus strain. When we come to the transmission, inhalation of aerosolized virus, direct contact with rodents or contaminated surfaces. These are the main transmissions, and rarely there is human to human, specifically in Android virus. Rodents population surges due to food abundance, mild winters, or human encroachment. The risk factors for hantavirus are rural homes, cabins, agricultural areas, camping in rodent-infested zones. When we come to the treatment and management of hantavirus, no universal antiviral cure exists. Treatment is mainly supportive. In hantavirus pulmonary syndrome, oxygen therapy, mechanical ventilation, fluid management, ICU care. In hemorrhagic fever with renal syndrome, fluid, electrolyte balance, dialysis if necessary, and ICU monitoring. As well as we can do experimental therapies. Ribavirin for hemorrhagic fever with renal syndrome and monoclonal antibodies, convalescent plasma. Long-term follow-up, lung, kidney function, mental health, and rehabilitation. Having said this, we're gonna now see about prevention and risk factor reduction. The first one is personal protection, gloves, masks, and long clothing and hand hygiene. Safe cleaning, ventilate, disinfect, avoid stirring dust, dispose of waste safely. The other one is rodent control, seal homes, remove food sources, trap rodents safely, and reduce outdoor rodent habitats. Vaccination research, experimental vaccines for hemorrhagic fever with renal syndrome. There is no global vaccine yet. In community measures, public awareness, occupational safety, and environmental cleanup. Let's continue to the epidemiology and the global impact of hantavirus. The distribution reaches North, South America, HPS, Europe and Asia, HFRS, and urban Seoul virus. Historical outbreaks. Korean War. Hemorrhagic fever with renal syndrome. In 1993, Four Corners, HPS in USA. Andes virus cases in South America. Yosemite National Park in 2012 outbreak. Ecological drivers, rodents population surges, climate change, human encroachment. When we come to the seasonality of this virus, in spring, fall peaks, winter indoor infestation. High-risk populations, rural residents, campers, outdoor workers, urban residents in rodent-infested areas. So the public should be aware of and get enough education to target this virus, and the target audiences should be high risk. Here, the core messages are avoid rodents firstly, safe cleaning and rodent-proof homes, and recognize symptoms, seek care, and educate others. Here, the education strategies for hantavirus should be in schools, community workshops, media campaigns including social media and workplace training, digital media, collaboration with local authorities, health departments, NGOs for sustainable prevention. That's how we can stop hantavirus from spreading and becoming pandemic. Measure knowledge, reduce rodent infestations, track case numbers, recap causes, transmission, symptom diagnosis, treatment, and prevention, epidemiology, as well as awareness in the community. So, my global recommendation here for hantavirus are individuals should avoid rodents, safe cleaning, and seek early care. Communities educate, maintain hygiene, report infestations. Governments surveillance, vaccination, research, outbreak preparedness. For travelers, avoid rodent exposure, stay informed about endemic areas. Very informed person is a life potentially saved. Prevention and early action are humanity's best weapons against hantavirus.